Well, hello everyone. Welcome to Ask a Doc. We're so glad to have you here today. My name is Lauren Letillier. I'm the Director of Communications and Community Engagement here at HCA Florida North Florida Hospital, and we have a very special guest with us today. We have Dr. Michael Jantz, who is an interventional pulmonologist here at HCA Florida North Florida Hospital. Thanks for joining us today, Dr. Jantz.
Thank you, Lauren. It's always a pleasure to come talk about things that I'm passionate about.
Yes, and you're so passionate about lung care, lung cancer care, and we're so happy to have you here for, we're going to talk about Lung Cancer Awareness Month, which is November. So this is the perfect time for us to talk about this stuff. So Dr. Jantz, we're so excited to have you. Thanks for joining us.
Well, thank you. I appreciate it. Lung cancer awareness is an important month, obviously, in terms of what I do. So I appreciate the opportunity to reach out to people and talk about this.
Yeah, absolutely. Before we get started, though, we're going to go through our pleasantries today. So I just want to make sure that we sound good. So go ahead. I'm watching everybody in the comments. So let us know if we sound good to you today. Also, go ahead and say hi. Tell us where you're watching from. We always love to see where everyone is watching from today and who all is watching. So thanks so much for joining us. Love to see the viewership, guys. Thanks for tuning in. Also, if you have any questions for Dr. Jantz, now is the time. You have him for the next about 15 to 20 minutes or so. So he's going to do a short presentation on lung cancer and screening, and then we'll go ahead and take your questions. So everybody, are you ready? You ready, Dr. Jantz?
I'm ready, thank you.
All right, Dr. Jantz, for those who may not know about you, go ahead and tell us a little bit more about yourself today.
I'm a pulmonologist, but I specialize in what's called interventional pulmonology, which are specialized advanced diagnostic procedures for lung conditions, as well as doing procedures therapeutically in the lungs and the airways to relieve symptoms for people that have various cancerous and non-cancerous conditions obstructing their airways or causing fluid around the lungs, that sort of thing. And then also I'm very, very focused on lung cancer. So I was previously at University of Florida for 21 years and now have come over to HCA North Florida Hospital and been here for about 18 months.
Yeah, absolutely distinguished physician in the field of lung care and pulmonology, interventional pulmonology. We are thrilled to have you here serving our patients. Thanks so much for joining us. So tell me a little bit more about the field of interventional pulmonology, understanding these risk factors, signs and symptoms. Tell us a little bit more about that.
Well, in terms of the interventional pulmonologist, again, there are sort of two hats. So one is the diagnostic hat. So diagnosing various lung conditions, but particularly, cancer, obviously the big thing
Right.
in terms of what I do, and obviously the focus of the talk today. And then the other hat I wear is the person who tries to do something therapeutically, with a scope in the airways to try to relieve blockages, improve people's breathing if they have a cancer blocking their airway, or if they have a cancer causing fluid collection around the lung, then trying to do something about that. But it's in terms of the Lung Cancer Awareness Month, we'll kind of focus more on my advanced diagnostic hat and talk about lung cancer and things for people to be aware of.
Yeah, and lung cancer screening has come so far. And I want to talk about that. So tell us a little bit more about lung cancer screening, when people should be screened, who should be screened. Tell us a little bit more.
Yeah, this is a really important thing and something that's not as adopted as I would like to see. And people, and I think unfortunately some physicians are not aware of this this practice that could save lives. And so there was a study some years ago called the Lung Cancer Screening Study, which actually showed that by doing what's called a low-dose chest CT, so a chest CT with much less radiation dose than the standard CT, if that was done once a year, lung cancers could be detected more early, and the reduction in mortality for the people that were screened was 20% compared to those that underwent conventional screening.
Wow.
So this
Incredible.
is a really big deal. And one of the unfortunate things about lung cancer is that usually by the time people get symptoms, the cancer has progressed and it's become advanced or even metastatic, meaning spread outside the chest. And so people can certainly be treated for that, and we certainly do treat people in that state, but they kind of have lost their shot for cure. And with lung cancer screening, if we detect these cancers early, then we can cure people. And this is really, I think, the big thing about lung cancer screening is that this allows us to catch things early and hopefully cure more people.
So who do you think would be like the ideal candidate to have this lung cancer screening that you're talking about?
Yeah, so the lung cancer screening guidelines have been out for a little while, but they were revised last year by the
Wow.
U.S. Preventative Health Task Force, and most of the major societies, chest and cancer-wise, have sort of adopted those. And so if you're between the age of 50 and 80, and if you have this thing that we call pack year smoking, so if you've had
Okay.
20 pack year history of cigarette use, that would make you eligible. Now, what the heck does a pack year mean? So basically, it's the amount of cigarettes you smoke a day times the number of years that you've smoked.
Okay.
So if I smoked one pack per day and I did that for 20 years, then I have 20 pack year history. And so
Ah, I
I
see.
would be eligible.
Okay.
And then it's for people that are currently smoking or have quit within the last 15 years. So if you kind of fit all three of those criteria, then you would be eligible for lung cancer screening. And again, that's done with what's called a low dose chest CT, and that's recommended to be done once a year.
Okay, that's fantastic. And you know, just to pop in, we also have a lung screening event that's going on actually this Saturday, November 5th. From 7 a.m. to 2 p.m. It's going to be at our Envision Imaging Center, which is right next to the hospital here at HCA Florida North Florida Hospital. We are recommending, and it's required to have a physician order to have this screening done, but we are scheduling people for this special screening day. So we hope that you guys will go ahead and take advantage of that if that's something you're interested in. Just a little, I had to do my little advertisement there, Dr. Jant. Sorry about
No,
that.
I think which is really good. So again, I think it's important for people to be aware
It is.
of this availability and particularly when what's being highlighted with the screening event. And
Yeah.
certainly people should feel very free to talk to their whichever is serving as their primary care physician to get them set up for this.
Absolutely.
Yeah.
So if someone gets screened and they get the unfortunate news, they hear the C word, right? Cancer. Well, you have lung cancer. What is the treatment for that? Can you tell us more?
Yeah, and I'll kind of just back you up just a little bit on
Okay,
that,
okay.
so we don't quite.
Sorry.
No, we're good. We don't quite go to the cancer thing, but
Yeah.
but we'll sort of take the example of the patient that gets screened and then they're found to have a nodule, so a spot in
Oh,
the
yeah.
lung, and so then it's the question of is this a cancer or is this not a cancer? And
Yep.
many people do have nodules. That actually the vast majority of them are not cancerous, thank God, but some of them are, and so that's where then kind of seeing somebody like myself that focuses a lot on nodule and lung cancer and kind of try to sort out, is this concerning? Is this not concerning?
Yeah.
Is this something that we can follow along and repeat some CT scans to see if it changes? Are we concerned about this, and should we talk about a biopsy? And we'll talk about the new technology I have to improve that.
Yes.
Or
Yes.
are we so concerned about this nodule that we should be thinking, well, we should really just go straight to surgery?
I see. Okay.
And then for people with early stage lung cancer, which is what we hope to find with this lung cancer screening thing, then typically we would talk about surgery, or if people couldn't have surgery, a special type of radiation, something called stereotactic radiation, which is high dose, high focus radiation just to that small cancer, also with the intent to cure.
Okay.
And then for the people that are kind of beyond stage 1 and stage 2, so the people that are more advanced in the chest, so stage 3, where unfortunately we kind of lost the opportunity for cure, we would now be talking about radiation or chemotherapy, or the patients that are even more advanced and have disease outside the chest, what we call metastatic disease. Then we would talk to our medical oncologist then about chemotherapy or immunotherapy or a combination of those two medications.
Gotcha. Okay. So before we get starting on the treatment that we were talking about, I want to thank everybody who's joining today. Thank you guys so much for watching. This is fantastic. We love to do this outreach to our community and tell you more about some of the the things that are going on at the hospital, and give you your health information through Ask a Doc. We have Dr. Michael Jantz here today. He's an interventional pulmonologist at HCA Florida North Florida Hospital, and he's here to give a little bit of a presentation on lung cancer for Lung Cancer Awareness Month, which is November, and also to take your questions today. So go ahead and put them in the comments. I see there's a lot of comments coming in, so thank you guys so much. But go ahead and put your questions for Dr. Jantz in the comments, and we will get to those here shortly. So Dr. Jantz, let's go ahead and pick up back on that. You talked about the different, kind of staging as well, and treatment too. I mean, there's so many different treatment options available for patients once they get screened, and if they do are found to have some sort of, nodule cancer. Can you talk a little bit more about that? There's certain stages as well.
So there are, correct. So with all the cancers, but but focusing on the lung cancer, there are different stages of the cancer, so different stages of the disease, and so staging really, for the most part, with lung cancer determines what's the best treatment for the patient. So patients with early cancer, so they would be in what we call stage 1, stage 2. So these are the people we really like to see because they have a high chance of being cured. And
Absolutely.
so again, with them, we're typically talking about surgery, and our surgeons are here. I'll brag on them. They're very good. They're state of the art. They're doing the surgeries robotically. So minimally invasive surgeries, patients out of the hospital much quicker recovery time. For the patients that can't have surgery because of other medical conditions or their lung function just won't tolerate it, then our radiation oncologists here are again, I'll brag on them. They're wonderful. And again, this very specialized type of radiation, this stereotactic, which is high dose, high focused, over 3 to 5 days, none of the usual side effects of radiation that people think about. Again, that's also with intent to cure these people. And then, unfortunately, as then we move to the higher stages, so stage 3, where now the lymph nodes in the chest are being involved, then most people are not going to be able to have surgery, and now we're going to talk about doing more standard radiation, as well as the medical oncologist, and again with medications, and for stage 4, where again spread outside the chest, then the medical oncologist again who are quite good, and so combinations of chemotherapy or something called immunotherapy, which is a newer treatment for lung cancer in the last some odd years, or a combination of those two things. And then also our oncologists here are able to offer people clinical trials if they're interested in doing things sort of beyond standard treatment in terms of being involved in the clinical trial.
There's something that's being done here that is not done at most centers. Is we offer robotic bronchoscopy, and that is something that you specialize in. Can you talk a little bit more about that? Because that is really opening the door for patients. It's a minimally invasive manner of treating or doing biopsies. And I want to learn a little bit more about that. Can you tell us a little bit more about that option for patients?
Yeah, so this has been a wonderful technology. So it's the latest that we have in bronchoscopy procedures to try to diagnose nodules, and we've had that for over a year now. And this is where basically we go through a scope down the back of the throat. It's very maneuverable, has like a GPS system that guides us to nodules, and I actually do drive the scope robotically. So
wow.
The robot's not doing it all. I'm still doing the driving. But it really allows us now to get very small nodules, very far out in the lung. That would be very difficult with more regular bronchoscopy procedures.
Wow.
So, fortunately, I'm doing very well with the robot. Our success rate for accurately diagnosing the nodule is between 85 and 90%.
That's
So
incredible.
we just did our 200th bronchoscopy the other day.
That's awesome. 200th. That's amazing. What a milestone. That's fantastic.
It's great.
Congratulations, Dr. Jan.
So this really does allow us then to for the person that we find this nodule, and again we have this discussion, is this cancer, is this not cancerous, we're not sure. We don't necessarily feel comfortable, either I or the patient, waiting another 3 months for a CT scan. Then we can go ahead and do robotic bronchoscopy and make a diagnosis either benign or malignant much earlier. And then of course for the people that we do find with cancer at a much smaller size, then again curative options now are now available. So it really I think has revolutionized what I do in terms of diagnosis of pulmonary nodules.
Wow. And is it an outpatient procedure? Is it safer than what, like surgery? Like, can you tell us a little bit more?
Yeah, so it's an outpatient procedure.
Wow, that's incredible.
The patient is under general anesthesia, since we're driving a scope robotically through a tube down the back of the throat. But outpatient procedure usually takes about an hour.
Oh my gosh! Wow.
I do believe it to be safer. With any lung biopsy procedure, we can, put a hole in the lung and collapse the lung down. The risk for that with this procedure is about 1%, as opposed to, depending on the study that you read, 10 to 15% with a needle biopsy from the outside. So
wow.
So yeah.
Significantly safer for the patient.
Significantly safer. Again, very, very high yield in terms of making a diagnosis. So absolutely.
That's awesome. Dr. Jantz, so I want to wrap up today. Tell us a little bit more about, and kind of wrap it up for us, what is your message to people as they are going through this process of getting screened, and, what's your message to people for Lung Cancer Awareness Month?
So a couple messages. So one, we didn't talk a whole lot about signs and symptoms of lung cancer.
That's a great point.
But just for people to be aware of, if some symptoms that kind of tend to raise my antenna, if you have a new cough that's not going away, that concerns me. If you're developing shortness of breath, again, that could be other things, but worsening shortness of breath, particularly with a new or worsening cough, would certainly make me concerned. If you're coughing up a little bit of blood and you're not having some bronchitis flare going on, that would certainly concern me. So those would sort of be the things I would ask people to kind of be aware of if they're at risk for lung cancer. That again, of course, it may be nothing. It could just be the cold, the flu, but things that are persistent like that are new and different, I would ask people to just kind of be concerned about, is there something going on, and talk to their primary care doctor about that.
I was just about to say, where should they start?
Exactly. And then obviously, we've talked about screening, and hopefully I've kind of implied how important that I think this is in terms of catching these cancers early before I see them, unfortunately, too late. And so I really would ask people to avail themselves of lung cancer screening, and certainly don't be afraid to talk to their primary care doctor or their pulmonologist and ask for this. It really does help. And then the last thing I would just sort of say is, if you have a nodule, it depends on the size, how concerned we are about that. We won't have time to go into that today, but just in general, for people, if you have a nodule that's greater than 8 or 10 millimeters, certainly, it at least would be something that should be on the radar. Okay. And whether that's by the primary care doctor who's going to do continued follow-up, or having a referral to a pulmonologist at that point, I think would be very, very reasonable. And certainly if there's question or concern, then seeing a pulmonologist like me, who that's a major focus of what they do, and I see thousands of them, and again have these advanced diagnostic tools to be able to sort things out earlier for people. So I think would kind of be my 3 messages for people out there.
That's fantastic, Dr. Jantz. Thank you so much. And thank you guys so much for joining us today. I want to take some questions now for Dr. Jantz. If you have those, go ahead and submit them in the comments. I'm watching the Facebook Live feed right now. If you guys have any questions, lots of shout outs, Dr. Jantz. You're a very popular guy. Best pulmonologist ever. Thank you, Jennifer, for saying that. That's awesome. Thank you, Dr. Jantz. Lots of everybody thanking you. And Dr. Jantz is the best. Thanks, Kimmy, so much. That's fantastic. Awesome. Love to see it. So I have a question that's come up here, Dr. Jantz. So does everyone have lung nodules? Can you fill us in on that?
No.
And is everyone cancer? if you do have one?
That's a great question. So not everybody has nodules, but a lot of people have nodules.
Okay.
So if you look at the lung cancer screening studies, depend on where that was done, up to 30% of patients will have a nodule detected when they're screened.
Wow.
So it's very common.
Okay.
And fortunately, most of them are not. So
Okay.
depending upon the screening study, maybe 5 to 10% are cancerous. So that's where my job comes in trying to discern what's concerning, what's not concerning. But again, fortunately, most of them will not be cancerous. But
So don't freak out.
don't freak out. Again, depending upon the size, it may need to be followed.
Yeah.
And definitely make sure if it is, again, people use some different cutoffs. I use 8 millimeters, particularly 10 millimeters or
Okay.
greater.
Okay.
Then definitely that should be on the radar, should be followed, or should be evaluated by a pulmonologist.
That's why your screening is so important.
Exactly.
So another question, Dr. Jantz, for you. This person says, I've experienced a lot of secondhand smoke in my life.
Mhm.
Should I be concerned and should I get screened?
Yeah. Great question. Obviously, we didn't really talk about specifically, but obviously, based on the guidelines for screening, smoking is the #1 cause of lung cancer in the United States. Secondhand smoke certainly does cause a small percentage of lung cancer.
Okay.
So it sort of depends upon how significant that is. Unfortunately, secondhand smoke is not recognized in the screening guidelines.
Okay.
Now, if somebody was very, very concerned and they felt like they had a lot of secondhand smoke, if they wanted some reassurance, one might consider undergoing screening, recognizing that that's not the recommended population to screen,
I see.
and that depending on insurance, it may or may not be covered for that indication
Gotcha.
by insurance.
Okay.
Yeah.
Well, that's good to know, Dr. Jantz. Thank you. We just have another question come in. I love this question. So this is I'm glad that someone asked this today. If you have a nodule, will they ever go away without intervention? What do you think, Dr. Jantz?
So some of these will be what we call inflammatory nodules, meaning that at some point when that CT was done, patients had a little bit of infection or a little bit of inflammation in the lungs, and then we repeat the scan and that will go away.
Okay.
For people that have more solid nodules, so sort of very well defined, very, very solid nodules, most of those will be there forever.
Wow.
And will remain relatively unchanged as long as they're not cancerous.
Interesting. Very interesting to me. Thank you so much for that question. That's awesome, guys. We've got another question that's come in. This is great, guys. Awesome. We're actually going to take, this is the last call for questions. So if you have any questions for Dr. Jantz, go ahead and put them in the comments right now, and we'll ask him here live on Ask a Doc. So Dr. Jantz, this question, they said, how I need to be screened. How often do I need to be screened?
Yeah. So if you fit the criteria, then again, it's what we call this low-dose CT. So CT
Okay.
scan that's done with much less of the radiation dose than standard CT. And so the recommendation is once a year,
Okay.
and you continue that until you're age 80.
Okay.
And Medicare doesn't pay anymore. Or you develop some health condition where nobody would think about treating a detected lung cancer.
I see.
But the quick answer is once a year, as long as no abnormalities are detected.
Oh, this is so nice. Dr. Jantz, Kim says, thank you for the many years of follow-up care you gave me. That's so awesome. Awesome, awesome, awesome. Well, I think that's a great way to end it, Dr. Jantz, don't you?
I appreciate the kind words that people
That is
have for me.
awesome. She
Yes.
says I'm still cancer-free. Thanks for
Yes.
sharing, Kim. Thanks for tuning in. That's awesome. Well, Dr. Jantz, is there anything else that you would like to tell everybody today before we end our broadcast?
If you fit the criteria, be screened.
Yes, and we have a screening event this weekend at our Envision Imaging Center. I'll go ahead and put the information for that event in the comments of this video once we're done here today. It's from 7 to 2 p.m. at our Envision Imaging Center. We recommend that you come with a physician order before you go and get screened. But it's a wonderful event if you guys are interested in having that screening done. Dr. Jantz, thank you so much for your time today.
My pleasure. Thank you very much, and thank you for all the people that tuned in.
Yeah. And thank you so much you've helped a lot of people, and I'm glad that they've tuned in today. That's so cool. Thank you so much for everything you do. And thank you guys for tuning in for another episode of Ask a Doc. We'll see you later for the next one.